Attendees are in listen-only mode.
Welcome everyone to today's webinar, Smartphones, Smart Coaches, Smart Patients, How to Use Digital Coaching in Diabetes Management. We're very happy to have all of you attend. We have a big group. We had over 550 registrants, so we know that a lot of you have questions about this. My name is Beth Frost Johnson, and I'll be moderating the session. So before we begin, we have just a few quick housekeeping details. Our speakers are going to welcome your questions throughout the sessions, but they'll be answering them at the end. So if you take a look at the control panel in the upper right-hand corner of your screen, you'll see an area at the bottom where it says Type Questions Here. Use that feature to type in questions throughout the webinar, and then at the end we'll gather all the questions and we'll have a Q&A sessions. And if we don't get to all the questions, we'll email you the questions with the answers after the webinar. We'll also be having a few quick polls today, and it's very easy to participate. So when the polling slides appear, all you have to do is click on the answer that best represents your views, and then you'll get to see the results of the whole group live. Now, most of you know about Healthy Interactions, who brings you this webinar today, but for those who don't, let me just share a quick overview for you. For over a decade, we've been providing validated patient engagement programs that improve outcomes for people with chronic diseases. I would guess that many of you are familiar with us through our Conversation Map programs, and now we also offer digital coaching platforms for scaled population management, which you'll see in the webinar today. And by the way, at the end of the webinar, for everyone who is attending, we are going to be giving you the digital coaching app for no cost. So you'll hear about how to access that at the end of the webinar. Over 100,000 healthcare professionals in 120 countries have been trained to facilitate our programs, and we have over 40 clinical and customer studies that have validated their efficacy. And we're very proud to say that over 25 million people have benefited from our programs. And most importantly, many of you have been a part of that. So we sincerely thank you. So here's what we're going to be talking about today. First, why digital coaching is a key strategy for your organization. And of course, as almost everything in healthcare does today, it is related to reimbursement and quality care. We're going to talk about the hows and the whys of digital coaching and how effective it is and exactly how it works in improving outcomes. Your entry into digital coaching using our Healthy Interactions digital platform and the support that you can get as you begin your digital coaching use. And I know for some of you, based upon some of the feedback that we have gotten, this is kind of a new component of your diabetes education program. So we want to make sure that we have good support for you. In fact, we have created a LinkedIn group where we're all going to be sharing best practices and tips and those types of things. And at the end of the webinar, you'll also see how to access that digital group in LinkedIn. So why is it such a key strategy for your organization? Well, you know, most of us are used to the DSME codes, right? Chronic care codes, televisit codes in the right circumstances, etc. But I would guess that you're already experiencing, it's not just in the future, we're already experiencing this, that there are many other kinds of reimbursement models and payment models. So you've got fee-for-service, DSME, if you can click this next slide and bring the detail in this, here we go. So value-based, pay per performance, and all of these types of financial models and reimbursement models have two things in common. Your organization is going to be paid on outcomes, not on how much service you delivered. It's going to be value-based and based upon outcomes, and your profitability is going to be determined on how efficiently you can deliver care. And digital platforms are what are going to allow you to efficiently deliver ongoing care to ensure that you have the most optimal outcomes. And in this particular case, of course, is that you keep those diabetes patients healthy. So that's what we're going to be covering today, and now I'd be very pleased to introduce our speakers. Healthy Interactions Anna Gofeld brings her experience in digital coaching and patient care to the development of HI Goals, our virtual coaching platform. Working closely with a digital team and healthcare professional users, she serves as a liaison that translates clinical needs into digital deliverables. Anna earned her Bachelor of Science degree in Nutrition and Food at Ryerson University, followed by a combination Masters of Applied Nutrition and Registered Dietitian Internship program at the University of Guelph. Our own Barbara Eichorst, Vice President of Clinical, is an internationally known asset in the chronic disease management arena and brings extensive clinical care and program administration experience with a driving passion and a generous dose of joy. She is currently leading the development and implementation of global training, having contributed much to the advancement in diabetes care. In addition to publishing numerous articles, she holds a Master's of Science degree in Nutrition Education, and most recently has been working toward her doctorate in the field of clinical care. And with that, I invite Anna and Barbara to take it from here.
Thank you so much, Beth. This is Barbara Eichorst. I'm very excited to be here and introduce you to our digital platform, but I'm confident it's going to make our diabetes education more effective and more enjoyable to do. So thank you for joining us today. We have over 500 sign up for this webinar, and I have looked through our attendance list, and I see a lot of familiar names. So thank you for joining us and then for supporting all we do at Health Interactions. So before we get started, I would like to reflect on my journey because I'm sure many of you will be able to relate to it as diabetes educators. So for me, it all started about 9 years ago when I have joined Healthy Interactions and started to work with the conversation map tools. I remember when I was interviewed for this position, I told the person that interviewed me that I feel that I have invented these maps because I have been doing it for the last 15 years prior with diabetes education, because we provide group education, it's all patient-centered, and now we have a tool for diabetes education that is a map that helps to kind of strategize and outline everything in a very engaging visual metaphors. So now when we're introducing the digital, I feel very the same way. And now with over 100 countries utilizing the conversation map tools, over 100,000 healthcare professionals worldwide, this conversation map tools became a global methodology to deliver diabetes self-managed education. And now with the introduction of our digital to support diabetes education, I feel that there's another big reason to celebrate 9 years after to introduce you to our digital, because I know and I'm very confident that it's going to create an impact and make our job easier as diabetes educators, as well as make it more impactful for people with diabetes. So what is diabetes self-management education, and how are we currently delivering it, and how is our digital fitting into this whole equation? So for diabetes self-management education, it's all about intelligent decision-making, analyzing different patterns of blood glucose and helping a person with diabetes manage it better. Like even within the name, diabetes self-management, that means it's self-managed condition by a person with diabetes. So we're used to seeing all of those graphs and all of the pie charts, and then helping a patient change their behaviors as a result of seeing how their eating, physical activity, stress, and other things impact blood glucose. Now we're getting into the different kind of pattern management, and that is a behavior change. Because as a result of knowing how the blood glucose is being impacted by different lifestyle situation, now we're kind of looking at a pattern goal setting. Every time we see a patient kind of sets up the goals and leaves the session and implements those goals. So with the digital platform that we have, is the one that is going to help us, diabetes educators, help to analyze those patterns and behaviors with goal settings, and then help the patients to permanent change in the way that they do things, so ultimately they become a healthier and healthier individual. So what is behavior change, and why does it matter? So I like this quote because it kind of relates to what we're doing with diabetes education. So the difference between school and life. And school is when we see a person with diabetes either at our one-on-one interaction or with group interaction. And life is what happens when a person leaves our session and needs to do what the patient committed or wanted to do in order to improve the outcomes. So in school, you're taught a lesson and given a test. In life, we're given a test that teaches us a lesson. And that's what really is happening with our patients. Those lessons and all of the work that needs to be done to create better outcomes is happening when we do not see the patient. It's happening when we don't communicate with the patient. And this is also the time when the patients are needing us the most, but we're not there for them. I mean, we are there for them when they call us or when they send us an email, but it's typically too late to really do any change. So we're not really being proactive, but more of a reactive to the situation that already happened. So with our digital platform, the goal is to really communicate and support the person with diabetes at a time where their life happens, when they're eating, when they're doing physical activity, when they're sick, when things are happening. So as a result of that, our role is kind of evolving from an educator, like maybe a teacher, to more of a coach. So that ownership is being shifted from the ownership of a disease management is really on a patient. And then we're there to kind of support, coach that person to get into the effective engagement and empowerment and then willingness, readiness, and just do those kind of things. So we can see with this nice visual where we, as a coach, we're there to motivate, support, lift our patient's spirits, support that person into the behavior change, and just be there when we're needed. Like a good analogy is to think of a sports. You have a sport coach and the sport players that play the game. So the stars are really the players. So we always see the game going on and great performance, but behind that great performance is a great coach who inspire those players, who support, inform, educate, and is there when the person needs it, not just at the time of a game, but also months or years before the game even starts. So I think that that's a good thing, and I like our role of diabetes educator to be evolving into the coach. Because we're still there for the disease management. We're experts in clinical care, and then we know things that the patient does not know. But the way that we deliver those things is a little bit different now, because we're not just teaching the person, but we are coaching them to implement those things. So talk a little bit more about support. I would like to ask you about what you're doing with support currently. So do you currently provide support in between your interactions with your patients, so between the sessions? So this is our first poll.
And this can be
we're going to give you a few moments to vote, and then we will share the results with you.
And this can be anything from additional group sessions to emails, phone calls, apps, or anything that you might mail out to your patients as well.
So we would like to have majority of you vote. So as soon as majority of you will vote, we're going to share the results. So it seems that majority of you do, at only 11% not, and rarely 35%, and often at 46%, and always 8%. I'm really happy to see that 8%, and then often 46%. And I see why. It's because support is something that is fairly new in our diabetes self-management practice. Just recently, I know that it happened like within the last few years, support was added to diabetes self-management education / now ask for support. So this is a practice that we're still growing. So now when we know that you do provide that support, let's ask you, how are you providing that support? Are you providing it through the digital platforms, emails, mail, video conferencing, or telephone? And we will give you a few moments to respond, and then we're going to share the results with you. So this way, you all will know a little bit about the profile of our attendees. Almost there. So these are the results. So 2% digital platform or app, mail 4%, email 16%, video conferencing 1%, and majority of you are doing it with telephone. And I can see why, because patients call us. We tell them, we give them their phone number to call us whenever there is a question or any support. So that totally makes sense to us.
And this does align with industry trends and what we're seeing out there. As well, it's good to see that even though telephone is definitely the most popular way of supporting our patients, there are other methods that we're using out there. And this makes a lot of sense. We all have different patient populations that have different needs, and so we need to really expand that roster of what we're offering in terms of support. But do we ever stop to wonder, is this the best way to offer support for them, or is this just what we're doing because it was in place when we got there? It's important to consider the person with diabetes, to consult with them, and to ask them what is the best way to provide care for them. We need to remind ourselves that they are the ones that are most important in this decision, and we need to figure out how we can support them in their daily life. As Barbara mentioned, to be that coach, maybe not so much the educator role where we're just teaching them to do things, but figuring out how their life works and how we can improve it with the diabetes support that we provide to them. A recent study that I stumbled upon actually surveyed 8,500 adults with diabetes and asked them about the impact that this chronic disease had on their life. About 61% said that it caused them distress. They talked about hypoglycemia and concerns about the negative impacts that this disease had on their emotional well-being, as well as relationship with loved ones who now were more worried about them. They wanted to help, but they didn't really know how. They didn't know how to get involved and be part of that care team. Only 51% reported they were having good or very good quality of life. That means that nearly half aren't living the life that they desire. They're not doing things that they want to do. We have to remember that persons with diabetes are the ones primarily responsible for their care on a daily basis. If we're their coach, we're there helping them to play the game, but they're the players. They're the ones at the forefront of management. And that's a lot of pressure at all times. In the same survey, patients reported adhering to medication and nutrition recommendations most often, but least often self-monitoring blood glucose and foot care. Now, as a dietitian, I was first really shocked to hear this, because I know we all stress how important knowing your numbers and caring about your feet is. But I realized I don't know very much about what it's like to have diabetes. All I know is what I need to teach and what the textbook rules are. So I decided to better understand my patient's perspective. I needed to be in their shoes as much as possible. So I grabbed a glucose monitor and I went home with it for a few days, tried to self-monitor my blood glucose, watch my feet, watch my diet, and it was incredibly difficult. I like to snack, and even though they're healthy snacks, I tend to eat every 3 hours. So making sure to check my sugar before I eat, as well as 2 hours after I ate, before the next snack, was really quite a challenge. I also got new shoes and got a blister. Now, if I had diabetes, that would be a huge concern. I really would have had to make sure those shoes fit and were worn in before I put them on. So that tells us that, every aspect of the patient's lives is impacted by their condition. And that's something we need to be incredibly mindful of. Only 24% of patients reported that their healthcare professional asked them about the impact that diabetes had on their lives. That's us. That tells me we're not doing a great job showing we care. So how do we improve that?
I think that this was, when you think about improvement in diabetes care, we all hear about the access being the primary reason or primary challenge in getting patients to see us. And you can see that access is a big challenge and a gap in the way that we provide diabetes education. only 7% of those who are eligible, 7% of those who are eligible for Medicare to attend diabetes education utilize its services. So this is a service that is available for free or very minimal cost to people, and only 7% of that group attends that. So what happens with those 93 who are not seeing us as diabetes educators? Where are they getting this education from? And they're getting it from their family and friends, which is a good thing because we want family and friends to be involved because as we know, especially with the DONE-2 study, it shows that the burden of managing diabetes is the same on a family as it is on a person with diabetes. So that's great. We're also getting it for other healthcare professionals, and I want to say other. That means not from us. So other healthcare professionals might be, you know, a website, a fancy website, or a book, or more like a product-specific diabetes intervention that is for general public, but not really individualizing the care the way that we do as diabetes educators, because we're part of the whole system and we're in a position to kind of understand the whole person and provide a holistic care. And then the final one is from other people with diabetes. And with the other people with diabetes, there is, you know, so many different websites, which is great, but patients are going in and getting that information. And I personally also go for those websites to kind of see what patients are asking each other. And oftentimes I find the questions that they're asking each other are not what they're asking us. So that means that they trust that community of other peers more than they trust us if they're asking those questions to them, or there's some reason that they're not asking those kind of things. So, but they're getting it from all those other resources. So that comes an opportunity for us. How can we reach those 93% of people in a way that they will be getting to us and getting that diabetes support that they need?
You know, Barbara, I actually Googled cure for diabetes the other day, and I came out with 50 million hits on Google. Can you imagine that? I mean, really, how do you decipher between which ones are credible and which ones are not? There's just such an overwhelming amount of information out there.
Yeah, and the cure is, the word you said, Anna, is cure for diabetes.
Absolutely.
So the cure is really the key. So what is credible and evidence-based in diabetes education? We actually know what works, and what works is we have a national standards for diabetes self-management education and support, and that is evidence-based. Those national standards are based on things that work, programs and deliverables and metrics that really create an impact, not just for person with diabetes, but for healthcare systems and everybody involved. So those national standards include 10 deliverables, and one of them is, the first one is internal structure. We have to have a structure with the programs that everybody talks and communicates and supports that holistic, you know, medical homes, we call it now, a chronic care model that is actually implemented in the actual setup. We have to have access to diabetes, and as diabetes educators are all involved in those decision making and part of that the big ecosystem that delivers those national standards. We have a program coordination. That means that we have an actual professional who's coordinating the care for a person with diabetes and helps the person with diabetes connect with their doctor, with their nurse, with their pharmacist, and then social support and everything that needs to be connected. Instructional staff, and many of times we're diabetes educators, so we're the instructional staff. We have to have a curriculum. That means that curriculum has to support evidence-based, not just the content, but also the way that curriculum is being delivered. That means that it has to be individualized to people's needs. So we no longer can copy and paste and produce a PowerPoint or a text messages that are just general. It has to really be individualized. When the patient is asking a question, we got to answer that question, not just provide them a blurb from general information, what is good for you, if it's not applicable to them. And then ongoing support, that means that once people, you know, complete those 10 hours of diabetes education that they have upon the diagnosis, their diabetes doesn't end there. Diabetes still continues, and diabetes changes, not just with time as a physiologically, people are changing and symptoms are changing, but also their life circumstances change. So we want to support that person in their changes in their life. And I like our newest guidelines for DSME kind of help us to kind of identify those changes in life that require additional support with diabetes education. So those point of care that could be, let's say, new job. It could be patient is being sick, has a heart attack, getting a divorce, kids go to college. All those things impact the lifestyle in a way that it alters diabetes care, but there is a place for us where we can help that person get better support and then be a part of that progress with diabetes management. And ultimately, number 10 and the final one is to really improve the quality of care for that person, but also that improves the quality of care for all the healthcare system.
Barbara, there's certainly a lot of content to cover in DSME. Many patients who need the education and support, lots of whom we're actually not reaching with traditional methods. I mean, we're in a time of change. We're in a digital era. Unfortunately, our patient population is getting younger, but this means that they're open to new approaches, and we need to embrace that. We need to use these new methodologies to our advantage to close the gap left behind by these traditional approaches. Digital solutions can really be an effective tool to better engage persons with diabetes, decrease the barriers to care you mentioned, and improve outcomes. We already know that a large percentage of our population of patients is using digital tools to engage in their health. But have you ever thought about how these can be used either as part of a DSMES program or on their own to help manage their diabetes? We know that access is an issue. We live in an increasingly digital world, and the advantage of that is starting to slowly trickle into the healthcare system and be embraced. We're seeing more reimbursement for remote care, and our patients are more often using their smart device to help improve their health, saving themselves and their providers time and money. A minute ago, we discussed some of the major barriers to access to DSMES, in particular, remote locations or traffic that patients have to deal with, just the sheer burden of getting to an office to see their educator can be overwhelming at times. Our patients may be time poor or have limited mobility. So using a digital platform really allows them to connect at the time and place that is most convenient for them. As well, the increasing reimbursement for remote care will allow organizations to decrease these barriers over time and for patients to have increased access with the help of digital tools. Often, our patients forget their questions by the time they get to see their educator or healthcare professional. They want to make an impression that they've been good or that they've taken our prior advice, and lots of them don't show up to appointments. They feel like they haven't been on track, which is really when they need our help the most. And this ends up being oversight of issues or gaps in their knowledge that really need to be addressed at the time that they happen. Having an avenue to have a casual conversation with patients encourages them to ask more questions and have an open dialogue with their educators. It creates more learning moments. It's that window for the teacher to come in at that point of confusion and say, hey, I'm here for you. What can I help you with? You can always access my care, whether you can get to my office or not. It allows our patients to get our guidance at the moment they need it most, which is often between or after our sessions. However, outside of those crucial moments, we want to encourage them to self-manage, using techniques such as goal setting and tracking. We all know the saying, out of sight, out of mind. Well, let's keep these goals in sight and on our patient's mind. Let's keep them at their fingertips. We've got these digital tools. They're already using their personal devices for health improvements. So let's help them manage their diabetes with that. Digital really allows for better use of the educator's time as well as the patient's time as well. It lets you use more resources because you don't need to be in your office all the time. The patient doesn't need to come in, check in, wait. So educators are able to support a larger number of patients in a smaller amount of time. And this allows you to use your time more effectively than you would if you were having the same amount of patients come in for traditional slots. The key point here is DSME activates and digital engages. We're teaching these people how to fish. So let's give them the fishing rod. Let's give them these digital tools that they can use.
I like what you said, Anna, about the learning moments. I used to say teachable moments a lot of times, and now I change it to learning moments, because it really doesn't matter if these are teachable moments for us. If they're not learning moments for our patients, that teaching doesn't produce outcomes. So I like saying learning moments these days. And I think that the same thing happens with what you said with the diabetes education activates versus the digital engages. And I think that the digital really allows for those learning moments. So learning moments are happening, and we as diabetes educators can provide those, teachable responses to people. But I would like to talk to you a little bit more about the actual diabetes education and how I personally have kind of incorporated a digital component into the existing diabetes education program. So what has happened is I have been using the conversation map tools with my patients, and I use it the way that they're intended, so as a full diabetes self-management education curriculum. And as you know, the diabetes conversation map tools are developed in collaboration with American Diabetes Association and are full DSME curriculum supporting Standard 6. What that means is that it has all those map tools, those 4 map tools for type 2 diabetes, have all of the components needed content-wise for people with diabetes to manage their condition the way that it should be. It also has the evaluation mechanism needed to kind of evaluate the impact of our intervention and teaching and education, as well as the way that it's being delivered in a group setup. And now, as you know, with our diabetes self-managed education as a service, it needs to be provided in group education. So 9 hours of DSME must be provided in group education. If we want to do a one-on-one, we have to have a justification why one-on-one is needed. So only 1 hour of those 10 hours is one-on-one. So you can see on the screen there is a group education happening. So once per week we use a one map, and then the same patients or other, they can always join, are invited once per week to attend a session, map session. So we cover all those 10 map tools. In between the map sessions, we activate the patients, or I have activated the patients with their with the actual app that includes the coaching. So I'm being their coach. What's nice about this is that those are my patients. I already know who they are, and then I already know their medical record, and then we already kind of are continuing on the same interventions that happen at the map session or education session. Oftentimes, those things are like you are already using other apps or other coaches, but those are not their patients. So there's issues with HIPAA, and there's a lot of issues. So what's nice about these is because I'm their provider of that care, and it's part of the same I'll call it ecosystem that they're kind of getting it. So in between the map session, there is a goal setting happening, and then there's a tracking of those goals, and I'm their coach. So as a coach, I communicate with them. So I'm going to tell you one story with my patient, one of my patients, and what I have learned from that. So it's kind of interesting because let's say one patient started from that group. He started on a goal setting, and then he left the session with focusing. His goal was breakfast. He wasn't eating breakfast. Now he's going to be eating breakfast. 2 days after, he lets me know that now, because I'm his coach, that he developed gout. So now when he has gout, our focus became more of a pain management. So we let go of this breakfast eating and other things that he was going to do as a proactive into more of a symptom management. So we kind of addressed the gout issue, and then once that was resolved, we were able to go back to the additional, implementation of his goals. if I would not have access to this patient with this coaching platform, I would never have known that he has gout. Most likely he would not communicate it with me. So I have selected this patient for and kind of reflect back on what has happened a few weeks after. So a few weeks after, that specific patient sends me a message, and this is all part of the same message. So he lost about 17 pounds, which is amazing. And then he sets his own goals now. So he's shooting to be 220 by February, which is in a few weeks now. And his A1C he's holding in 6.3, which is really good. Holding to 6.3 hemoglobin A1C while he has gout. This is really good because, as you know, pain increases blood glucose. So he was able to kind of stay within blood glucose goals because of the communication with me. And I like that the first bubble that you see, that he is working on staying away from bread. I didn't tell him to stay away from bread. He wanted to stay away from bread because he realized that bread increases his blood glucose. And as you know, that self-monitoring of blood glucose does not always produces better outcomes. Just the fact that people monitor blood glucose doesn't mean that they're going to have better A1Cs. For a simple reason, they don't always respond and modify their behavior in response to it. So this guy realized how the blood glucose is being impacted by bread. So he's making that decision on his own, which is pretty remarkable. And that's what really the best self-management is. He's owning the decision making. That's his decision making. He came up with that solution. I didn't come up with that solution. He came up with his own solution, and that's what patient-centered education is all about. So for me, I have learned three things from this. Number one is that we're in a position to provide coordinated care in between between a MAP session or any group education with using digital to still communicate with the patient. Number two is digital really creates engagement. As we know that diabetes education is really dose dependent. The more interaction we have with the person with diabetes, the better outcomes. So that was my my second item. And the third is that I have learned to better communicate with my patient because I have learned that it's not just enough to say, hey, good job. That my communication as a coach needs to be very short, strategic, supportive, and not just educational. Because if it's just educational, content, they can find that content anywhere online. So my competition is this. The information, a lot of information exists. So I strategize on how can I be better than the stuff they can find on the website, which has so many, and how can I be better than existing coaches because I'm a diabetes educator. So how do I provide more value for them? So this was a very insightful experience for me, and I know it's going to be for you as well when you start using our digital platform.
Barbara, I'd just like to highlight what you said, that you received this because you were using the digital platform. I think we can both agree that if you hadn't introduced the HI digital platform to your patients at that session, you would have never gotten this feedback. You probably wouldn't have known what was going on in this patient's life until months after he had come to see you and given you the update. But this way, you're creating that open conversation, that dialogue, that you're able to check in with him, and he can give you the feedback as well. And that's so important. So at this point, I'd like to introduce our digital platform to everyone attending today. The HI digital platform is a series of 3 tools that are used to integrate with each other seamlessly to help coaches and patients better interact. It's comprised of 2 apps and a web portal. The app on the left is called HI Goals. You can see it on your screen. And that is the patient-facing portal. They can set their goals, track their progress, see curated content, and have coaching. So in the goals, these are all SMART goals. They can be specific about what they want to do, how much they want to do, because we all know that everyone's going to be at a different starting point and have a different ability to progress through their goals. So this really lets them individualize it to what they want to do, what they're able to do. They're also able to track it so they can see how they've been doing over time. It aggregates into a graph, which patients can then view and reflect on it themselves. They can see how their blood sugar has been influenced by these goals based on what they've done and other goals that they've set as well. If they had a question, as Barbara and I mentioned previously, they don't have to go and decipher between those 50 million pages on Google that can tell them about their diabetes. We put some of the most asked questions, such as carb counting, self-monitoring blood glucose, activity, and a few other things, into curated content that's specifically been reviewed and comprised by CDEs just like you to give your patients the most credible information out there. And coaching, this is my favorite part personally. This is that I need my coach and I can access them. This is that key part where that patient is sending Barbara the information, the questions, the ability for them to communicate with their coach. And they can do this at any time. On the coach's side, they will receive this message and they can answer it at the time that they are available. So this doesn't have to be an instant message, but it's still going to be more time sensitive than a response. It would be a better timed response than if they were to come into your office and have to schedule an appointment. The coach can also review the goals set by the patient and how they're doing. And this is a great conversation starter because you can send your patient little snippets saying, hey, I saw you doing really great with your walking goal. Keep up the great work. Doesn't look like you're reaching your vegetable goal this week. Here's a tip to do that. And it really creates that window of opportunity, that digital door for you to knock on your patient door and say, hey, I'm here for you. I know how you're doing and I'm checking up on you. I care. It keeps them accountable because they know that you're there, you're engaged. And when you're engaged, they're engaged. And the fact that this app is also a web application makes it a lot easier for those of us having to access it at work. So you don't have to pull out your phone all the time. You can also copy and paste things into your EMR from the web portal if needed. I personally like to put all the goals in there for my patient so that they know I'm thinking about it. And when they go to message me, a lot of the times they'll ask me what their goals are and how they can move forward in addition to the ones that they've been setting in the app. And this is a really great way for them to remember things. It allows us to support our patients when they're needed outside of the schedule. Overall, this helps to increase the patient's engagement, and we all know that positively correlates to outcomes. For the educator, you can coach your patients between sessions, and even when a patient is tardy, you can sort of check in and see how everybody else is doing. It also keeps things simple. If you see on the left screen of the coach's view, that's a patient list. So we don't have all the things that we see in our EMR with all the demographics. It's really an easy way to just come in and check up on your patient. At Healthy Interactions, our ultimate goal is to engage patients and educate them about their chronic disease and inspire them to live longer, healthier lives and undergo behavior change that will allow them to do that. To reach our goal, we like to take a comprehensive approach that includes conversation maps to inspire peer interactions and digital tools that allow for conversations to happen beyond those sessions, ultimately leading to better self-management. We designed the HI digital platform with the healthcare provider in mind. This allows you to maximize your time and have better patient outcomes and get those CCM reimbursements. Chronic disease management is hard, so we want to provide the tools that will best help your team and your patients to succeed.
So the tools are really for everybody, for the dietitians, for the nurses, for pharmacists, for everybody involved in diabetes education. What makes it very unique is that no matter if you're a pharmacist or a dietitian, then you can customize your intervention. So when I was telling you my story, I was kind of talking more about nutritional management of their diabetes education as a dietitian. But if you're a pharmacist, you can kind of communicate with the patients and do medication management, anything that goes within your scope of practice within a discipline. But we're all providing diabetes education, which makes it really unique.
That's right, and it depends on what your role is. You're going to work it into your workflow a little bit differently, but it can still work for everyone. So for example, if you're doing a conversation map or a different group session, you can write the name of the app, HI Goals, on the screen. along with your coach code. Get the patients to download the app right then and there, and they can set goals directly in it. No more lost pieces of paper or, hey coach, what was I supposed to do this week? It's right there for them. They set it right there, set it and forget it. It's one of those. Or in this case, don't forget it because it's going to be at your fingertips. If you're doing a lot of one-on-one sessions, you can place a poster just in your office with the name of the app and provide your coach code to those patients who you feel need those touch points more often. Remember, it's free for the patient to download and self-monitor using the HI Goals app, but to connect with you, they'll need your code. Get your team on board. We can't stress this enough. We all know that diabetes management is a team approach from the patient side as well as the educator side. And when our whole healthcare team is on board, our patients are encouraged. It tells them that we trust this application and that we all stand behind it. It really showcases it as a credible tool in their health management. Now, a lot of you are probably thinking, how do I become a coach? And that's quite simple. At the end of this webinar, you're all going to receive a thank you email with a link. When you click on that, you'll be asked to enter some information, and we'll send you your personal coach code and password. Follow up with downloading the HI Coach and HI Goals app onto your smartphone, and log into both those apps as well as the web portal at the address you see here using those credentials. Just remember to reset your password after the initial login. The HI Coach portal is where you'll be able to send your patients prompt messages, see their progress, as well as message yourself in your test coach application. The HI Goals is the patient's view, so you can see what they're seeing, track goals as they'll be tracking, and see how you're doing. See how you measure up against your patients. It also allows you to sort of walk the patient through if they have a question. A lot of our patients may be a little bit hesitant to download an app because they don't feel very comfortable with their smart technology yet. But when you're able to show it to them, they can sort of become more accustomed to it in their office and see how simple it is and how easy it is to use. And that's it. Just start coaching and tracking your own goals. As an HI digital coach, you'll have access to the platform from anywhere that you are. So it's remote access through the app as well as through the portal, which is optimized for your tablets and your PCs. This remote access allows you to quickly check in and offer support anywhere, anytime. Answer those patients' questions, when you're waiting for an appointment or if you're on your way somewhere. You can just quickly log in and send them a little ping. Let them know you're thinking about them. This app also ensures the privacy of your patients through a double code protection on your mobile app, making it HIPAA compliant. The other thing I really like about it is that it helps keep my personal and work life separate on my mobile device. So it helps keep that patient information private, unlike something that would be sent in a text message or an email where I always worry about somebody picking up my phone and finding out confidential information. This double code really helps me feel more secure about the information that's on my phone and doesn't compromise my patient's safety. It's also non-intrusive, which is quite nice because we all have about 1 million apps on our phones these days, probably making different noises and sending us notifications. With this one, we only get 1 email a day from any unread messages. What I like to do is simply go in after my lunch break and check if I have any messages from my patients, send them some quick encouraging words, and that's it. It also helps to eliminate some of those messages I get in my inbox. Now, the platform itself is focused on helping you support your patients and retain them, keep them engaged. Since you'll be able to touch base more frequently, each interaction, both digital and in the real world, will be shorter, so you'll have more efficient use of your time. It also helps decrease some of those barriers to access your patient space. They no longer need to get to your office in order to receive support. This is especially important for those that live in rural communities or patients that have disabilities and may need a little extra help getting places. The information provided here is credible. That's the key word here. It's backed by healthcare professionals. It's backed by their coach. As Barbara mentioned, it's great that these were her patients. She knew them and they knew her. So the diabetes information section offers a lot more content curated by CDEs. But beyond that, it's great that you have a person who you already trust on the other end answering your questions. Much better than anything you're going to find in Google. We're also constantly working to update the app. We want to make sure that this continues to fit with educators' needs. And so as a user, you're going to be that subject matter expert who we go to for ideas on improvements. This will help you continuously have an app that meets your needs on an ongoing basis. Getting the patient set up is quite easy as well. All you have to do is ask them to download the HI Goals app on their smartphone, provide them with your personal coach code, and have them enter the basic information when they register. And that's it. They can just start tracking. Now, if they want to download this at home and they don't have your code on hand at that time, not a problem either. They can just enter it at a later date. Some patients like to go in and self-monitor and start working on their own and then add in or their coach at a later time. And that's really a great option for them to have if they want to, be a little bit more independent. The digital coach platform from the patient side is really helpful to help them track their goals, to see where they need to improve and where they're doing well. It makes smart goal setting fun and easy. It's got some of the top goals we typically set with our patients. And it doesn't make them have to check back with us to tell us how they're doing, which can often be skewed by memory. They often forget some of the challenges and just highlight their achievements, which is fantastic. But again, it's those learning moments, we want to maximize them. And the app allows the coach to check in and open up more of those learning moments by providing encouragement in the areas that they see that the patient needs. So the continuous information that is input by your patient is aggregated into a progress chart for each goal, which you can then see and sort of discuss with your patient. Most importantly is the app is simple to use, both for the coach and the patient. The font's large, there's not too many features, and it's a really clean design. And I think that's what really sets this apart from all the other apps that are out there, which have so much functionality, it just overwhelms us and our patients. Now, similar to map sessions, we know that every person is going to come in and have a totally different experience with the app and any interactions we have. We want to know more about how you're enjoying it, how your patients are using it, and how it's changing your practice. So we encourage you all to join us in this conversation on LinkedIn in the Diabetes Educators Using Conversation Maps and Digital Coaching Platform support group that we've got going on LinkedIn. Barbara and I will check in almost daily to put in tips, peer support, and other sort of tidbits on how you can best use this platform to incorporate it into your practice. The ultimate goal of the app is to improve diabetes care outcomes. So we look to the literature to see what else is out there. Is anybody else using digital tools to support persons with diabetes, and what does that look like?
So what is the evidence that digital platform works? We know it works. So there's 3 studies that we would like to showcase to you briefly. Number 1, we know that apps deliver better clinical care outcomes. Number 2, when you're looking at is that app and other digital platforms improve hemoglobin A1C as much as a really good diabetes education, or even better. And the third one is that mobile health technology improves healthcare behaviors. What I would like to point out to you very briefly is the middle study, because what Beth was just saying at the beginning, that it's all where we're shifting for a fee for service, now it's value-based, outcome-driven practice. This is where digital can help us to kind of get better performance out of diabetes education. And in this case, it's twice as good as a typical diabetes education. So it does make a big difference. And we know that engaged patients are better off compared to the ones that are not that engaged. So they do better with every single self-management, deliver better outcomes. They take their medications and all of that stuff better. They do better discussions with their physicians if they're engaged. The last one that you're looking at is they're more involved in the shared decision-making technologies, and that's part of the reason that we are providing the digital platform to our patients, because the engaged patients are more likely to use the platform, and we want them to use a credible and evidence-based, and part of the whole interaction, the national standard medical home platform for them with our digital platform.
So we've learned a great deal from you. Thank you for answering all those polls, and we hope that you learned something from us as well, and that you can use these digital tools in your practice. And we hope to continue this conversation with you on our LinkedIn group. We want to continue to hear feedback from you on how useful this webinar is and how useful the HI digital platform is in your practice.
Thanks, Anna and Barbara, but don't leave yet. Here's a few things you need to know before we start our Q&A session. As soon as we're finished today, you'll be receiving a survey that we encourage you to complete and a thank you email that contains 2 links, a link to a link to download the coaching program, which will be yours to use at no cost, and a link to our new LinkedIn group where we will share best practices. And those emails will be coming from Melissa Augimeri at healthyinteractions.com. So we hope to hear from you on all 3 of those. And now we have a few questions to answer. Our first question is from Jeanette in Raleigh, North Carolina. What is the difference between your HI Goals app and other diabetes management coaching apps in the marketplace?
That's a great question, Jeanette. So I think there's a few things that are different. Number one, it's simple and easy to use. A lot of them out there are really overwhelming. They send a lot of notifications, and our patients just get so overwhelmed with these messages that they just give up. So this is really a non-intrusive app that allows them to connect when they need us and allows us to really monitor and moderate our interactions with them to make sure that it's at a level that the patient wants, because everyone's going to have a different comfort level of how often they want to interact. So this helps to really control that in the sense that it helps to personalize it. Also, the people behind it. I think that's so very important because lots of apps out there don't have credible healthcare professionals. They don't have CDEs behind them. Ours does. The coach that is talking to the patients in the MAP sessions is the same one that's going to be connecting with them through this app, through this mobile platform. And that's a nice connection that you already know the face behind the names. You're not just connecting blindly. As well, it helps that this app, lives in the background, and it helps that patients are able to access curated information. So if they have questions, it's not just about going in and having to Google things. They have information at their fingertips.
Okay, we have a question from Nick in Ohio. And Nick, I could have asked this question. Is the app easy to use? I'm not great at using my iPhone. Will I be able to learn quickly?
I think so. I mean, I gave it to my grandmother, and she's 79, and she loved it. She loved that there was only like 3 screens. She didn't have to flip between things. It was easy with the contrast, so it wasn't hard on the eyes. We've given this to several patients that were of various comfort levels with their technology, and they've had no issues using it. So I sincerely hope that you will enjoy using it as well.
Thanks, Anna. Here's one from Dominique in Milton. How fast should I be getting back to my patients?
That's a great question. So we hope that you check in with your patients every day or two. As I mentioned, the platform will send you an email if you have pending messages. But even when you don't, we recommend that you go in every 2 days or so just to see if you can provide any touch points of encouragement. And this is actually really quick to do because you can just skim through your list of patients, quickly see how their graphs are looking, and based on that, just send them a quick note. So every 2 days or so.
Okay, great. We have a question regarding the BlackBerry and whether or not it is compatible with Blackberries.
You know what? I'm going to have to check with our engineering team, and we will certainly get back to you on that.
Okay, terrific. And then we have one last question from Joanna in Minneapolis. Is there specific data that patients can track in goals that I would be able to see and respond to, such as glucose levels, carb counting, etc.?
So the goals that are set in there right now are they've got weight in there, as well as some SMART goals, such as how many fruits and vegetables they've eaten, if they've checked their glucose, if they've relaxed, how many steps they've walked. So that data that is input into the app, you can certainly see all of those goals on the coach side. We are working to put in more integration with Time, such as blood glucose monitoring. It is not a feature that we have out now, but it is certainly coming soon.
Okay, thank you very much, Anna and Barbara, and most of all, thank you very much for all of you who attended today and watched for those emails. You can download the app and begin to put it to good use, along with the support that you'll be getting in our LinkedIn group. Thanks, everyone. Bye-bye now.